Hello, everybody. This week we're talking about combined health system and picking from the different parts of the world to make one good health system. So, before I start, I just want to talk about how by picking strengths from each different country, we can hopefully one day get this quality access and better health for all with better innovations as well. So, first we have the United States. So, some strengths of the United States is that overall we have well trained workforce. We're one of the best medical outcomes in the world because of big of how big we are within each state, how well our education is. We have great medical specialists, so you could be getting taken care of in Chicago and have to be flown somewhere else because of where the medical specialist is. And when it came to COVID, we actually had one of the best trying to get access to the COVID shots quickly. I don't know if you guys remember, but I remember sitting in my house during COVID, and then all of a sudden it's like, okay, you can go get your first COVID shot. And then I was getting my second one, and then I got my booster. So we had great research team members that were able to research to get us better access and quick access. And we learned from these other countries as well, like their mistakes to help us as well. So now we go into Canada. So Canada has great access to universal health care. Their out-of-pocket expenses are reduced. It promotes social equity. So those three things I just listed off that you guys could see is that it was a health card that the government issues, which would allow access to essential medical services no matter your income, age, or health status. So this would promote fair and just health care that ultimately Canada was prioritizing its citizens by having this medical card where it would allow all this. So during COVID, they came up with these risk assessments that they would send out to see what they needed to do. And then something also called the IHSPR, which was the Institute of Health Research's Institute of Health Services of Policy Research. So this was a policy research type of thing, kind of like how the United States had research as well. And it was able to fund 99 different research institutes during COVID to be able to fund these vaccinations and get the resources they needed to handle COVID. And then this little chart is the 5 principles of the Canada Health Act. So it's just, I thought that was very interesting to put up there for you all to see from 1 through 5, how you public administration. Then it goes all the way to portability. You guys can see that, so I won't go over it. And then we move into France. So France has high quality, affordable care. It's accessible to all legal residents. And one thing of theirs that is a very big strength of theirs is they get choice of provider. So they are going to be able to choose their provider, and there's also the structure of the healthcare system right there. But one thing I think that would help all of these systems is having that accessible to all residents, this high quality, very great. France is known for it because it's so affordable. So now we go to Jordan. So something that Jordan was great with during COVID specifically was they were able to acquire ventilators super quickly. And then they were able to get this PPE. They ramped it up, got as much PPE as they could, and then realized they had so much, they actually helped out other countries and were able to give PPE to these other countries. And they did this through their crisis management system, which is one of their strengths of their healthcare system is that they have this crisis management team that is able to tackle these crises. And this diagram is everybody that's part of the crisis management system. So Obviously, you see it's very big, but it's such a big strength of theirs that we could all learn from it. And then we have Japan. So Japan is kind of different. Their health insurance is either employment based or resident based, but 100% of the population is covered, as you can see from this diagram. So you could have an employment plan or just a residence plan, depending on like if you have a job or not. They are all about this term patient-centeredness, which means that care is based off the patient's decision for a correct diagnosis. They're all about getting the diagnosis right away so that you're not having all these extra labs and tests done. And then they also have universal health insurance. And then this chart kind of shows that yes, 100% of the population is covered, but then it kind of goes into a weakness that there are co-payments for certain things, which I'm sure we all know that there's a lot of co-payments, a lot in the United States. I mean, I've done it. I've gone through it. So some strengths and weaknesses of healthcare globally is that some strengths are we have high success rate. A lot of countries do. We have this personalized care as like the big thing every country is trying to do. But we also have some weaknesses, which in all of these countries, so this combined healthcare system would work well. But you would still probably have limited number of physicians, so we would have to try to figure that out. The high staff turnover, no matter how great your healthcare system is, it's proven that the staff turnover is still going to be there. And then I just kind of put up the whole SWOT that I found because I thought it was interesting about the opportunities and threats that could be going on with the global healthcare system and these healthcare systems in general. And then I wanted to just quickly at the end talk about innovation. So I found that these are the top 10 healthcare trends and innovations in 2023. But based off this combined healthcare system I just talked about, I think that efficient, high quality care is something we're going to have to work on as neighboring countries. We all need to work on those labs, getting in quicker, getting more staff. So we will be needing some of these, the mobile health, the big data and analytics, immersive technology. These are all things that are going to help us accomplish, hopefully, universal health care coverage for all. But I think this combined healthcare system could potentially work, but all those weaknesses are still going to be there. So we still need to get better and come up with a better healthcare system for everybody. And it's impossible because there's strengths and weaknesses to all. And then these are my references. Thank you.